Hello, I'm Dr. Dovich with Northwest Eye. At Northwest Eye, you'll see us in clinic at one of our locations, and then on the day of surgery, we're going to go to a surgery center that's located in Minnetonka. We actually have two surgery centers in Minnetonka, and this is one of the locations here in North Minnetonka, kind of where the 394 and the 169 intersect. When you come to the surgery center, you'll come in the front door. This is our waiting room. You'll probably meet Raven, who's typically here most days. And then from there, we're going to bring you back into your preoperative holding area, which is over here. We have a wonderful team of nurses who will help to assist with your surgical experience. But we'll bring you back here. This here is a standard preoperative bay. What we do here is we just have you come, we sit down on the bed, we answer any questions you might have, we review today's procedure, we go through the consent form. Again, we answer all questions that you may have thought of from when you had your consult in our clinic to the day of surgery. Once you're comfortable with the procedure and the plan, our nursing staff is going to work with you to get you hooked up to our monitors. We monitor your blood pressure, your vital signs. Part of modern day cataract surgery is making sure that you have great anesthesia. So we do multiple types of anesthesia. One of the anesthesia types is just anesthesia straight to your eye. My first over 10,000 surgeries we did, that was how we primarily did the cataract surgery, was just straight with anesthesia to the eye. But here in Northwest Eye, we also offer IV anesthesia, which is more similar to a colonoscopy experience where you're a little bit drowsy. We don't fully put you to sleep. You don't need general anesthesia for eye surgery because it's a very fast process. Generally, between 5 to 10 minutes is going to be the average cataract surgery for most surgeons at Northwest Eye. Once you're comfortable, you lay down. We'll start dilating the eye after we've identified which eye we're going to be working on. Our nurse will start an IV, and then once your IV is set and your pupils dilated, and we reviewed all the paperwork, answered your questions, from there, we're going to take you in this bed. We're not going to have to transfer or anything like that. We use the same bed, and we're going to just bring you now in your bed and roll you down the hall. And I'll show you one of our operating rooms that we work in. So over here, this is a standard operating room that we use for eye surgery. As you can see, there we go. We have, this is for our nurse anesthetist to make sure that your vital signs are monitored and your anesthesia is fully taken care of. This is our operating microscope. This allows us to be able to visualize everything within the inside of your eye. What I love about these scopes, they're Zeiss, they're fantastic. They give us great optical clarity. They also do some video recording. So if there's a issue that we want to review or use as a teaching moment for other students or residents or fellows, we can show a video of a complex surgery or interesting procedure or something like that. Over here we have, this is our sterile trays. This is our phaco emulsification machine. This is a standard machine. There's many different types of these machines in the US. We really enjoy using this Bausch & Lomb machine here at Northwest Eye. This allows us to fully remove your cataract in a very safe manner. And the way modern day cataracts are removed with phaco emulsification is this is an ultrasound energy. It actually breaks up your cataract into smaller pieces, and then we just sort of suck it out of the eye with a little, it looks kind of like a little metallic straw basically. And once the cataract's safely and fully removed, we then reinsert some viscoelastic, which is a heavy gel, into your eye, reform the inside of the capsular bag, and slide your new lens of choice into the eye. We then remove all that gel, we hydrate the wound. Most patients don't even have to have a suture placed in their eye with cataract surgery. The whole process is, like I said, generally completed within 5 to 10 minutes. And then after we've been in this room and you're all done, we then come out to the recovery room, which is just around the corner. We bring you to one of these bays here. Your bed would be here. You would sit up. Our nurses will take out your IV. They'll do your final paperwork, answer any questions, review your post-operative instructions, and then also make sure that you have all the eye medications you need to recover well. Usually you're in this bay for maybe another 10 or 15 minutes. And then once you're ready and feeling stable and ready to go and be discharged with a friend or family member, they'll bring your person that is helping you get home into the bay, and they'll take you out to the car and you'll be all done. So That's kind of just a brief tour of kind of how it looks inside one of the surgery centers here at Northwest Eye. Like I said, we have 2 places that we do surgery, and both of them are Minnetonka addresses, and we look forward to helping you on your day of surgery.